Hello everyone, I am Jannatul Tandra and we are from Group-5 and our project is about COVID patient tracker system and my other two members are Mahmudul, Hasan, Emon and Sadia, Sobhana, Ridi. We wanted to make a simple yet efficient project to help the COVID affected patients so that they can easily get their service as per the requirements and by observing the ratio governments can take effective measures to reduce this crisis as soon as possible and we have so many features in our system for example users can see the updated list of hospitals, ICU beds, available vaccine slots, and appointments of doctor. Also, they can book for their COVID test slot, and authority will keep a track of their daily affected death and recovery patient list and send it to the authority to make a effective measures by observing those ratios. And now requirement analysis are divided into two parts, functional requirements and non-functional requirements. For non-functional requirements, user firstly needs to register their cells to the system and then they can log into the system using their name and password and all the only the registered users will be able to book an appointment for doctors and or slot for COVID test and vaccines and all their all their data will be stored in the authorities database and after seeing those data of affected and unaffected persons list authority will update their database on a daily basis and they will also send their data to government so that they can enforce lockdown by analyzing those ratios and take extra steps to make people aware of the dangers of this of the disease. Non-functional requirements. So we have make sure that our system can be run on any web browser and our system will be kept updated within every 5 milliseconds and if anyone tries to it tries to log into the system without any registration, users will get a notification to verify them so that any hackers won't able to read or modify their personal data and we have make sure that our system will provide the capability to backup their data. For example, if any users mistakenly delete their information from the system, they don't need to register themselves again and we have make sure that our system can be built into a low budget. For use case diagram, we have three actors. Patients is our primary actors and other two secondary actors are hospital and government. So here patients can log into the system and if anyone gives wrong information, they will see an login error and they can see the list of hospitals as for example after seeing the doctor's appointment list they can book for their appointment and after and if there is no available appointment for them they can send a request for queue and after seeing the request queue, hospital authority will update their list and they will send a notification of opening a new slot. If any patient cancel their appointment, hospital authority will update their appointment status as well. And patient can pay their fee using online or offline transaction, and then later after after patients needs to provide their information into the system, and after seeing those information, hospital make a sorted the list of affected, unaffected and dead patient list, and they make a ratio of that, and after sorting those ratio, they send it to the government, and after and reviewing those ratio, the highest percentage list of COVID patients areas, they enforce lockdown, and the least percentage areas, people's areas, they try to send uh, awareness takes through SMS or email users, so that everyone can take their self to self quarantined, and take extra necessity steps to reduce from this danger. Thank you, and the next part will be covered by Mahmudul Hasan Emon.
Hello everyone, I am Mahmudul. Today I will going to talk about activity diagram and sequence diagram for our project COVID patient record system. First of all, our activity diagram is divided into two parts. One is for patient and hospital authority, and another is for hospital authority and government authority. For patient hospital authority activity diagram, patient can log in using their username and password. If patient's login is authorized, then hospital authority will confirm patient's login. After login, patient can able to see the updated list of appointment schedule of doctors, available ICU beds, amount of vaccines, etc. by choosing their preferred language. Then if they find any available seats, then they can book a appointment for doctor or their vaccine, etc. And the hospital authority will check the reason for booking and send a confirmation to patient through the system. But if there is no slots available, then patient can add a queue on the particular slots, and if the slots available, then the system will notify again the patient. Moreover, patient can test his or her COVID result. The hospital authority will examine it and send the report to patient through the system. Also, hospital authority will keep track of daily affected and recovery ratio of COVID affected people. Then patient can contact emergency number and the hospital authority will respond. Patient can request to book a ICU seats. If there are available ICU seats, the hospital authority will confirm and admit the patient. The next diagram is for hospital and government authority. For hospital and government authority activity diagram, hospital authority will send the daily updated list of COVID affected, dead and recovery ratio to the government authority. Government authority will observe the ratio. If the ratio is high, then they will enforce lockdown to the red zone area, and if the ratio is low, then they will alert the common people to wear masks, using sanitizer via SMS through the system. My next part is sequence diagram. First, our sequence diagram is divided into two parts. One is for patient and hospital authority, and another is for hospital authority and government authority. In this video, I am going to cover the patient and hospital authority sequence diagram. In patient and hospital authority sequence diagram, first, patient can log in using their username and password, and hospital authority will confirm if the login is authorized or not. Then patient will request to see the updated list of appointment slots for doctors, vaccines, etc. Hospital authority will send the updated list to the patient. Then patient search an appointment for doctors or vaccine. Then here is come a condition box. If the seats are available, then hospital authority will confirm the booking. But if there are no slots available, then patient will request to add a QE on that particular slots. When the slots are available, the hospital authority will notify the patient again. Also, patient can cancel their booking anytime, and the hospital authority will keep track of their empty slots. Then, patient can test his or her COVID result. The hospital authority will examine and send the result to the patient. Also, the hospital authority will keep track of the daily affected, recovery, dead people list. Patient can contact with emergency number and the designated people will respond their query. Patient can search for ICU beds. And here is come another condition box. If there are available seats of ICU, then hospital authority will confirm and admit the patient, or hospital authority will suggest the patient to look for another hospital. The next sequence diagram for hospital authority and the government authority will be covered by my next team member. Thank you.
Assalamu alaikum everyone. I am Sadia Sobhana Ridi. I am going to present our second part of sequence diagram and data flow diagram level 0 and level 1 for our project. At first, I am going to show our sequence diagram for hospital authority and government authority. Here, hospital authority can update their databases, which is a self-message. They can send the affected and recovery ratio of COVID patient on a regular basis. After receiving the message, government authority can observe the whole situations and decides accordingly. Here is an alternative box which shows two possible situations. If affected list increase high in an alarming rate, then government will enforce lockdown and laws to keep people stay at their home. Else, government can make sure people wear mask and use sanitizer. Now, I am going to present our data flow diagram level 0. Level 0 is the simplest level. In this level, our entire software system is in one big process. We have three external entities. For example, patient, hospital, authority. And this is our big process. From entity to process, there are data flows. Our software system need a lot of informations. Here, patient can request for login informations, username and password, list of hospital, payment methods to process. Then our process can read that information. Similarly, when hospital authorities send registration confirmation, then process shows their profile. So, government authority receive updated information from hospital authority. They immediately send awareness messages. This is how data flows from entities to softwares in level 0 diagram. In level 0, we show that the entire software system, but in level 1, we can break those processes into small pieces and try to understand every process, how every process works. The important thing is our external entities, for example, patient, hospital, authority remain same. The new addition is data files, which is also called databases. If I zoom into our process 2, it is list of hospitals. Patient entity sent data asking about preferred hospital list. Process immediately search in hospital account database. If database have available hospital list, patient can get that data through process 2. Similarly, we can see another process. Let's talk about process 10, which is COVID update information. Government authority wants updated list of COVID cases, whereas hospital provide the COVID ratio list data. which is stored in COVID database. So this process 10 can provide COVID updates to government authority. So this is our entire data flow diagram level 1. Thank you.